In the educational system, the medical field is considered particularly challenging. We have assembled an elite squad of former Woodbury students to discuss these challenges. These are their stories.
My name is Maggie Ludwig. I'm a nurse anesthetist. I was in Mr. Rafferty's class back in 2002. Graduated high school in 2008 from Woodbury High School. And then I went to UW-Madison for college where I studied nursing. Graduated there in 2013 and then worked as a nurse for 5 years at UW Hospital in Madison. I worked in the cardiac ICU, so I worked mostly with heart surgery patients, anything from heart transplants to bypass surgery to lung transplants and beyond. After working there for 5 years, I decided I wanted to go back to grad school to become a nurse anesthetist, and I graduated from the University of Minnesota with my doctorate in nursing practice in nurse anesthesia in 2021. Oh, there's so many cool things about being a nurse. I mean, being able to be the one next to a patient the whole time. I've done really crazy things from CPR multiple times to helping someone take their first walk or first breath after getting a breathing tube out, after getting a new set of lungs. To be able to see a patient go from really, really sick to getting better and feeling so much better and being able to do things that they weren't able to do before. So the reason I decided to go back to school to be a nurse anesthetist is because first off, you have more independence than you do as a nurse. Oftentimes you are the only one in the operating room who's responsible for anesthesia for that patient. I also liked that you only have one patient at a time, whereas as a nurse in the ICU, sometimes you have 2 patients, sometimes I had 3 to 4, so you're running between rooms. And in anesthesia, you just focus on one patient at a time, so I really liked that. So anesthesia is basically when someone's undergoing surgery or some sort of painful procedure, you can make them amnesic, which means forget that it happened, have analgesia, which is pain, so they're both sleepy and pain-free, so they can get through a painful procedure safely.
Well, could I'd like to experience this anesthesia. Would you be able to demonstrate that on me?
Yeah, let's put you under.
Really? Okay. Hey, and while you're at it, I've had a few problems with my feet too. Could you see if you could fix those?
You know, I have a history with transplants, so maybe we could do a foot transplant.
I'm all prepped for surgery. On with the show.
So this is the monitor that gives all our vital signs readings. At the top we have our EKG, usually in green, and then we have usually in blue the waveform for your pulse ox or your oxygen levels. And then usually we have a reading for blood pressure. It'll be a number like 120/80 is about normal. And then we'll have another screen that's the ventilator. So that is the machine that keeps you breathing while you're asleep, and it'll show you numbers like how big of breaths you're taking, how fast you're breathing, and it'll also show you how much anesthetic gas you're getting. While you're under anesthesia, you might experience some vivid dreams. Okay, Mr. Rafferty, count down from 100. Go anesthesia. So when a patient's under anesthesia, we have to monitor their vital signs. That's the most important thing. Every 5 minutes at least, sometimes every 1 minute. One of the most important vital signs we look at is called blood pressure. So usually what we do is we put a cuff around the arm and it squeezes and takes a measurement of the blood pressure. What is blood pressure? It's basically the pressure that is exerted by the blood inside your blood vessels. So if your blood pressure is really high, that means it's pushing really hard against the walls of your blood pressure. It's like really hammering the walls. If your blood pressure is low, that means it's just kind of like it's lightly tapping. You might have your blood pressure's low, you might pass out. It's not a good thing. If blood pressure's too low, that means sometimes your organs, like your liver or your kidneys, aren't getting enough blood and oxygen, so they might not work as well as they're supposed to. If it's too high, that can put a lot of stress on your blood vessels. It can make some of them burst. For example, a stroke can sometimes be caused by having too high blood pressure. Or high blood pressure can also damage a lot of your organs, including your heart, common cause of heart attacks, or your kidneys too. So that's why we monitor blood pressure, to make sure it doesn't get too low or even too high. So another thing we monitor during anesthesia is called an EKG, or electrocardiogram. It measures the electrical potentials of the heart. So basically, in order for your heart to beat, it's got to send out a little bout of electricity in order to contract the muscle. So we can capture that and see what the heart rhythm is doing. So normally, your heart is going to contract atria, ventricle, atria, ventricle, atria, ventricle. Sometimes funny things can happen where you're just, everything's firing like crazy, and that's not good. You're not pumping well enough. Pumping normally, that means the rest of your body isn't getting enough blood, and when you're not getting enough blood, you're not getting enough oxygen, and oxygen is what your cells need to survive and to produce energy. So if your heart's not pumping right, all your organs aren't getting what they need, and they can start to malfunction. So another important vital sign that we monitor during anesthesia is called oxygen saturation. So we monitor that with a little clip on your finger. We call it pulse ox. So basically what a pulse ox is it emits different wavelengths of light to be able to tell how much oxygen is bound to a protein on your red blood cells called hemoglobin. The more oxygen that's bound to hemoglobin, the better. A normal rating is usually like 98 to 100%. So if your oxygen level dips below that, that's a sign that maybe your organs are not getting enough oxygen. Another thing we do for patients during anesthesia is give them pain medicine. So the gas we have patients breathe doesn't actually treat pain, it just makes you sleepy. So in addition, we have to give you medicines through your IV, so a little catheter or tube that goes inside a vein. We give you medicines that help prevent pain. And how they do that is they bind to receptors on neurons that block the neurons from firing, so they don't transfer a signal of pain up to your brain.
Nelly for your heater fire similar.
Hello, Mr. Rafferty. How are you feeling?
I'm feeling a little woozy, but I had the most interesting educational dream. In fact, it would make an awesome episode. Well, I can't wait to try out my new feet. Did the surgery go okay?
Well, yes, but there wasn't a donor available. So we just put your left foot onto your right leg and your right foot onto your left leg.
What?
Well, that's our show. And even though my surgery didn't go as I had hoped, it still was great spending time with a former student and learning about nursing and anesthesiology. Well, it's time for my physical therapy appointment. Until next time, so long.